the signing of the second memorandum for the development of initiative of e-health, and we are going to speak about it in more detail. I'm Yuriy Bugay, coordinator of the public initiative for introducing technologies. It is called e-health in healthcare of Ukraine. Our meeting will be based like this. So I will tell you about the memorandum and the first product we are going to work with, and then the speakers, the representatives of the ministry and the representatives of different NGOs will tell several words about logic and principle about this initiative, about the aim of this project, and then we are going to ask questions, because today we have 22nd of December, and of course journalists also should have time to relax. And a month ago we signed the first memorandum on the introduction of the initiative of e-health that envisages principles and goals. Then we said that during the month, in the framework of work of the initiative group, we will show what this initiative will be and the technical requirements to the first product. And today we do this, and all the documents, all the materials we are going to present today will be on the site of the Ministry of Health, and we provide access to all the materials we work on. Speaking briefly, key principle and key aim of the first service, and this is the administrative function. One of the key reforms the ministry implement is the introduction of so-called money goes after patient, and in order that this money really follow the patient and we could monitor the efficiency of the use of this money, we create this first product in order to do this online. We continue to discuss the technologies that can be used and the architecture that can be used by the system, but on the whole there is understanding about the first project, and that will be also placed and the references will be provided. And this is the addition to the memorandum. It will be on the site of the ministry. We will share it in the media. And based on this product, we are going to develop further services. The task number one is administrative, to monitor where the money goes after patient. So I would like to give the floor to Acting Minister of Healthcare of Ukraine, Dr. Ulana Suprun. She's going to greet you now. Thank you. At the Ministry of Health, we greet the signing of the second memorandum with the working group that is now working on the program e-health. The ministry supports active cooperation with the civil society that take responsibility to build and to implement those changes that started in the system of healthcare. Our values are openness, transparency, cooperation with public, and they are supported in the first and in the second memorandum. We sign with our friends, with our colleagues, and our developers of e-health. This is an important part of reform because this develops all our areas of cooperation, and it was discussed that the reforms of the first level of medical assistance and the also system of financing where money goes after patient, and it is important that e-health be implemented, and we would monitor the financing and to create register of the patients and the register of doctors that is non-existent in Ukraine. This public initiative is against all schemes, and it creates the opportunity that we create new cooperation between doctors and patients, and also between doctors, patients, and the system of public health. And that is supported by the ministry, and we can better control provision of medical assistance. That is the very important part of our reforms, and to develop the network of medical institutions that they could communicate among themselves and provide the route for the patient. And also the public initiative of the creation of the system of e-health. It is joined by 120 participants, experts, volunteers, organizations, and people who can provide advice and create system of e-health that it worked here in Ukraine. And the creation of the electronic services and the healthcare, this is a breakthrough for Ukraine, and its approximation to the standards of developed countries of the West. And we go to Europe, and our system of healthcare should be more European. In the European system, in the majority of countries, it is developed in the framework of e-health, and we can transfer to the system through the cooperation of our experts who can provide advice and build the system, this architecture that would help us throughout our system of healthcare. The efficient control is possible to create only in condition of creating electronic services, in order that human factor won't be a part of the system, because, as always, we know a lot of corruption schemes. These are connected with human factor, and when there is system in financing and monitoring of the service, then the system will be less dependent on human factor, and then there will be a global system built that is e-health and the system of healthcare. And you should understand that the system of Prozoro that exists for state procurement and other procurements, it works really great, transparently and openly, and we can see all the tenders, and we all can see the process, how it is done. And e-health system is the elder brother or elder sister of Prozoro. This is a bigger system that is more complicated. But we see from our friends, we hear that there is a consortium that was started, it's Prozoro system that joined our group, our working group, and it will develop further. And we would like to see that our system, e-health, would be in Ukraine. And we believe that it will be. They want to see our system, they like our system Prozoro, and they would want such system e-health, because it really works greatly, and it helps those who are in the ministry and to the patient. And we believe that in other countries they would like to have such system as in Ukraine. Thank you.
Thank you to Ms. Ulana Suprun, PhD, and now we are giving the floor to Dmytro Shymkiv, Deputy Head of the Presidential Administration of Ukraine, who is an active supporter of all electronic systems. First of all, I would like to greet everyone, because Prozoro started from 4 memoranda, which joined more and more people gradually, and today it is important to join many teams around the e-health system. It is more complicated. There are few examples of successful introduction of e-health, because it is introduced from top to according to top-down method. Doctors, IT specialists, people who created Prozoro system, all of them are members of the team creating e-health system, and looking into the description of the functions, the relationship between patients, doctors, ministry, they are outlined in detail, and administrative information we need to fill the system and to start its implementation. This is an important element when Ukrainian IT, which to the IT specialists who often work for creating other countries' health systems, they now work in Ukraine. So Prozora, is a unique system which has won many prizes already. We created our best practice, our best solution, which is could be used, and e-health product. We didn't have systems previously in healthcare. Electronic government is available only in private clinics so far, but we should transfer the experience, the best practices of private clinics into governmental medical institutions, so that electronic government is introduced, and we understand what services are provided by doctors to patients. Sometimes they are virtual patients and doctors, and it was interesting for us what happens with virtual services, and what real patients, what services they really are delivered. So I greet us, and I understand that there will be opponents. We have opponents to Prozora as well. But let's move forward and build the system, because I'm sure that creating this system we will accelerate the reform of healthcare locally. The next speaker will be Deputy Minister of Healthcare of Ukraine, Pavlo Kovtoniuk. He is responsible for the launch of electronic healthcare system. Thank you for giving me the floor. Good afternoon. I am very glad, as we promised months ago, by the end of the year, we will have the second technical memorandum signed as to a health system development in Ukraine. I am very glad to see how the team of IT specialists is working on a health establishment in Ukraine. Of course, there are debates and there are some opposition, aspects of opposition, but we are glad because we see progress, and the speed of creating the system is rather high. The format is open. Everyone can make its own contribution to development of the system. Of course, democracy is a complicated thing. A special role is played by moderators in the process. So I would like to thank especially Yuriy Bugay, Irina Shevchenko. She is not here, but they are coordinators of the teamwork. What we signed today, we signed technical document. This is a document demonstrating what specific product we would like to have to start the healthcare reform, and what are the deadlines. I'm very glad to sign as a representative of ministry of such as the document with specific dates, specific features of the product. We have very specific goal as fast as possible, as soon as possible, to start reform, and we want to start it with the health at once. We understand that any compromise between online and paper ends with the paper winning. So we would like to start reform online at once, immediately. We face a real challenge. We should work fast and demonstrate excellent teamwork. This memorandum is a start, and we start our path. So thank you to everyone, and let's start moving forward on the path. In order to understand where e-health will be in the general e-government context, we are giving the floor to Andriy Piskun, advisor to the head of the State Agency for E-Governance in Ukraine. Good afternoon. E-health is to make life of people easier. Patients should benefit from a health system. On the other hand, this is the opportunity to analyze what is happening and to forecast next steps. A health system should be in one of the components of governance, because every person is a citizen, is a member of our society. All services should be linked to each other. We should use an integrated approach and engage many stakeholders, businesses, and the state. The agency will support initiatives on development of a health system and further integration into a government as it is. In order to guarantee accountability and transparency of teamwork, Transparency International joined our efforts, so I'm giving the floor to the head of the board of Transparency International, Andriy Marusev. Good evening. I would like to stress once again why for Transparency International and citizens of Ukraine, why we engaged in this initiative. The first, why we are doing this, it is for comfort, for user-friendly access to medical services, healthcare services, to get medical services. So if as for me, I lost my medical history long time ago. So when I come to any outpatients clinic, they ask me, medical personnel ask me, where is your medical history, but I don't have any card, any history. So when we have electronic documents, it would be easy to get access to medical history of a patient. The second point is efficiency. Thanks to register of patients, drugs, they will be electronic, and Ms. Suprun already said that we are moving towards European standards. 2 weeks ago, I was at the anti-corruption conference in Minsk in Belarus. They already started to introduce electronic healthcare services, but Ukraine lacks these services, although Belarus has them. So we should at least cope with the lag which we have with our neighbors from post-Soviet countries. The system of healthcare should be maximum transparent for everyone, for patients, for governmental authorities, for doctors, for all stakeholders. We should have preventive mechanisms from the very beginning which would prevent corruption. How to do that at the last by dialogue, by meetings, by we have more than 120 stakeholders. This is important in terms of strategy, and this is a strategy of development of Ukrainian society. When businesses, civil society, NGOs, and governmental institutions, we start open discussion, we build trust, we build confidence in society. That is why we take example of Prozora system, because this is an example of best practice for the whole world. It was created via dialogue of all stakeholders, NGOs, governmental institutions. So it is very important, and I hope as a result we will get an example, a successful case both for Ukraine and for the entire world.
Among us, there are also stakeholders of patient organizations. That's why I give the floor to Dmytro Sherembey, who is the coordinator of LGBT Network.
Когда-то очень много лет.
So, when you fight for the rights of the patient, you have some instincts, and for me, it was a phenomenon. So the ministry wants to open all the system, all the documents, and make it transparent. The fact that a year ago or 2 years ago, it was something really impossible, just impossible, unfortunately. But fortunately, now we have a team who really declare all those things, and everyone can contribute. So businesses, NGOs, all the new system, the green light is given for development, and we should understand that this is not only just platform for intellectual competition. So the healthcare system has a direct effect. So these are lives and health of the patient. So I live with lethal disease, and I believe that my life depends on the system and the quality of the system. Millions of people in this country depend on the system. They were unaware, they didn't understand what protocol will be used for them, and it was a difficult process. Healthcare was really closed system of healthcare, and I'm really grateful to Prozora, Transparency International, the ministry, that we got this opportunity, and starting next year we will see the first results of this program. You know that a lot of people die because of lack of medical help and the medicines. And in modern world, there are technologies that can be used. People bury relatives and loved ones, and I believe that everything that will contribute to the development of the system should be implemented, and everything that create obstacles should be rejected, because this delay of the introduction of such a system will cost lives of people in this country. And we, as patient organization, our funds, we have 36 funds in this country, and we will do everything in order to implement the system. We will support the ministry, and we want to see how this medical history of the person will be also implemented in the system, and we will thus save money, and there will be less mistakes and more opportunities to save life. And the Ministry of Health, 88 billion will be invested to the healthcare and next year, and this is the first time when we see that how these resources will be spent, and we will support the system, and all patient organizations of Ukraine start when it is going, they wait when the system will be introduced. In Ukraine, a lot of medicines at the level of national level and regional level, a lot of medicines are procured, and one oncologist center resold 28 million. So they resell a lot of medicines for 28 million, and one relative got medical history of the person who was in the center, and they saw how this money was. So we believe that all the registers of the medicines, they should be open, and we spent 3 years for this. For Bogadareva, for everyone after her, we asked them just open information about medicines that was procured by the state, and they said we have all the signatures needed, that we have all the documents, but in reality these were just money that were taken by the chief doctors. And now we developed a module that provide the basis of all the clients, and it was in Odessa, and we gathered the doctors, and I showed them how many medicines they have in the hospital, and there was 26 medicines for 26 million in this single hospital, and you can see what medicines are in what institution. So in stomatology of the city was 500,000 implants. People just didn't know that should be distributed for free. So this is 500,000. We are not so poor. We just are not open, not transparent. That was the problem. Have you ever seen a hospital where there is 620,000 syringes? So now the systems, they should be accessible, and these systems should be comfortable for patients, and I believe that lives will be saved due to the system implementation. Thank you.
Щиро дякуємо всім, хто виступив, звернувся.
Thank you very much, and I would like to thank the coordination group, because now only me is on the stage, and all these technical requirements were developed by the team, and the memorandum was also developed by a team. And one of the next things we are going to do is we will develop the first product, and it is envisaged by the memorandum. During 2 months, we promise publicly that it will be launched in pilot mode. The initiative is open, and the principles and of first and second memorandum are implemented. So we can have different views on the system. We believe that there is a wish to create it fast, and there are urgent needs of different stakeholders. The ministry and us as the taxpayers, we want to balance things. And there is time limit, and also the aim, big aim we go to. And at the same time, there is opportunity to develop a parallel initiative, and we are open for cooperation and discussions. Now we have the opportunity for 1 or 2 questions from the journalists. If you have questions, I would like to ask the participants. We have many meetings. We would like to ask journalists whether they have questions.
Тоді можна від учасника групи Тимофія Бадікова.
Okay, the participants of the group are going to tell us. So we are parents for vaccination. I would like to add one thing that we do not know what is in clinics, and there is no instrument, strategic influence. So in one hospital there are a lot of medicines, and there is lack of medicine in other hospitals. So, for example, in some hospitals there are no rooms for vaccinations, and there are doctors that have medicines, and other hospitals who live in remote areas and they do not have proper access to drugs. That's why we support this system, and we hope that vaccination will be included in the system. Thank you very much. All the materials will be on the site. The official part is over, and now we have 10 or 15 minutes to sign the memorandum, and I hope that all the participants who want to join, you see that this memorandum is here, and now we ask the minister to sign the memorandum, and then everyone can join. Thank you very much for your attention. Till the next time, goodbye.
Дякую. Підписую меморандум.
So I sign the memorandum with the pen with inscription that this is of Defense and Security Council. So this is really important for security of our citizens. They should have proper access to healthcare, and with great delight I sign second memorandum, and I hope that in 2 months we will be here and we will show first product.
Я тепер би просила,
Now I would like to maybe Pavlo will continue.
Дякую.
Thank you. I sign the second memorandum. I will say the same words I said when I signed first memorandum. Here, point 2.8 are the obligations of the group, and we as the ministry, we are obliged to create all conditions in order that this initiative group work. And saying these words, I signed the document.
І всіх запрошую.
And please join us. Please come up together.
Тут положу. Ага. Ну, після підписання там восени.
After signing in spring 2014, when the memorandum on Prozora was signed, they say that we hope that we really can contribute to this.
Сьогодні 22 у нас, да?
Today we have to add a second.
В принципі, вже в вільному порядку. Якщо когось цікавлять релізи, то в нас також є релізи, які знаходяться на рецепції, ви їх можете...
So we have press releases. You can read about this event and you can disseminate this information. It is available on Facebook and at the site of the ministry.
Дякую.
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 Дякую. Дякую. Дякую.
Что там творится в интернете? Я понимаю.
Ну що, там ще місце є?
Угу.
Чин-чин. подписался, просто